So welcome to our first part of our ONE walkthrough, where we have our business information analysts, Andrew and Samantha, who are going to walk us through a ONE application. So this will be the first of two parts. And Andrew, you're going to be the one that's doing most of the speaking, so I'm going to hand it over to you.
Sorry, it took me a minute to get off mute there. Hey, I'm Andrew Demaray, use he, him pronouns, and I am a ONE senior business analyst for the applicant portal, or the ONE online portal and the ONE Oregon mobile app. And yeah, I'll be doing a couple things today. First, we're gonna show what it looks like when you create an account for a case that already exists in our system, and then we'll create a new account and go through the application process that way. While I present, my coworker Samantha Brookshire will be answering questions in the chat. Samantha, do you want to introduce yourself?
Hey friends, I'm Samantha Brookshire. I'm the strategic systems analyst with the ONE online portal. I work with Andrew as well as our other ONE BAs on all of our customer facing systems. And if you have questions, Andrew has a lot to get through today. So please leave yourself muted, put them in chat, and I will be working my very best to get responses into chat for you. If I don't get to your question, I will pick it up and email you a response at a later date. So take it away, Andrew. Thanks for running this.
Yep. And I'll also invite you, Samantha, to raise your hand or interrupt me if there's something that seems particularly on topic that we should pause for. Although I will be trying to keep the pace going so that we can make sure we get through this whole presentation. So first off, just a little disclaimer, we're working in one of our testing environments, our UAT testing environments. Things may be slightly slow in places, and it's not exactly indicative of how the system runs. It runs a little bit smoother in production sometimes, but hopefully we have a nice and smooth presentation here. So I'm just going to refresh this page to make sure we're all fresh and ready to go. And first thing I'm going to do here is click apply now. And as mentioned, the first step I'm going to do here is show what it looks like when you create an online account for a case that already exists with benefits in our system. So when you first get to this landing page for setting up your account, you have an option to create an account for individual or authorized representative. We're going to choose individual. And this person will enter their first and last name, their email address,
Andrew, could you make that a little bit bigger for some of us? There you go. Thanks.
Yeah. So we'll create a username as well as a password and verify that password. And then we'll click submit. And we get this message to finish setting up our account, check our email. We're going to be sending an email confirmation link to the email. And for testing purposes in our testing system, we use a free email service called Mailinator. And in our live environment, this email would come to the person applying, and they would have a link to click to verify their email. It wouldn't look exactly like this. What I'm going to do is copy this URL here and plug it in, and it will end up on the same page that we would with our public-facing email verification. So step 1 is complete. We verified our email. Click step 2 to continue. So now we'll log into the account that we began creating in that first step. We'll verify that we're not a robot. Sometimes we'll get a reCAPTCHA tool popping up here that we need to verify. And once that's been completed, we'll click the verify button, which will give access to the username and password fields. So once we log in here, it'll bring us to our RIDP process, which is remote identity proofing. It's going to ask us questions about our identity. And we have a address match service. Since I entered a fake address, it's not going to pull anything up that's been recognized by the US Postal Service. I'll do a real address when we create the new application so you can see what that looks like. So we're going to choose and continue to keep the address that I entered. Again, we have another reCAPTCHA. And then when this loads, we should see a series of questions. This process is run through Experian and will pull information from similar sources that you would in like a credit check and from credit history, essentially. These are mock questions that are in our system, but this would pull old addresses, registered vehicles, things like that. So we've successfully verified our identity through the RIDP process. We'll click next. And as mentioned, since this individual already exists with a case in our system, it should bring us to the individual dashboard showing us that case information. So I'm going to decline to go paperless currently because that would take us off this page. So we can see the individual dashboard here for the online portal. It will display everything from current benefits being received for cash and SNAP, active benefits for TANF and SNAP here, active benefits for medical here. If there was childcare benefits associated, oh, there is, excuse me, forgot that I added childcare when I set this up. They would show down here. So other useful things we have here are these links to the verification of current cash benefits, food benefits, medical benefits, and childcare benefits. So individuals no longer need to go into the office to get those documents. We have navigation tools over here to report a change, update contact information, as well as those other functions there. I believe in our next presentation, we'll cover a little bit more of navigating around this dashboard and different things that can be done here. So that was to show what happens when there's a case that already exists in the system. I'm going to back out now, sign out, and we'll start over and we'll create a brand new case. So we're going to choose create an account over here. And we're back at that setting up your account screen that we were at before. We're again going to choose individual here. Enter a username and password. Submit, and we'll, this is actually a good thing for our demonstration purposes. It'll show if the user ID is already in use, please try a different user ID. It's an indication that down here, we need to choose a different username. So let's try Bob Belcher 3. And within the applicant portal system, or the ONE online portal system, we'll have a number of different errors that would pop up there if something needs to be addressed or changed on the screen. Verify our email. Step 1 is complete, so we'll continue again to step 2. We'll log in. I'm so happy it's not making me do the reCAPTCHA. Gotta grab a mock social security number. Okay, and so now that this is a real address, we should see our address matching software is pulled up in actual US postal address here. So we can stick with the address that we entered, or we can choose a suggested address by the system. We'll go with the suggested address. We'll complete the RIDP questions. And we have successfully verified identity. So both of these examples I've used, we've shown what it would look like in a successful RIDP situation. There are instances in our system where, for a number of different reasons, either not enough credit history information, information entered incorrectly, errors would occur during this RIDP process, at which point the user will be prompted to either contact our tech support team, our tech team, or to contact Experian. We recommend contacting our tech team because they're familiar with our system and can get folks set up and ready to go and help clear those errors and get identities verified. So differently than what we saw the last time we did this, this is bringing us directly to an application. So what that tells me is that the individual you created here in this user account creation process does not exist in our system and hasn't been matched to any other existing individuals in our system. So this Let's Get Started page has some introductory information about the benefits that are available that individuals and families can apply for through ODHS. This next page is going to ask what we're applying for. And we're going to say this individual doesn't know what they qualify for. So they're going to just click everything, and we'll go through an application when someone's requesting all these benefits. This first screen here is asking if you want to get local help. And that's essentially asking if you would like to have an OHP community partner assister. And if you click yes to this question, it'll open an option to search for a medical community partner or assister. Those are organizations and individuals who can help apply for medical benefits. I'm going to say no for the purpose of this application. Similarly to the previous screen, this is asking for representative information, slightly different than a community partner. This is someone who will act as a representative for the individual applying. They can be an authorized representative to help with information stuff like apply for benefits, receive notices, or they can be an authorized payee, which would allow them to have access to the actual benefits that that person is receiving. When this is clicked yes, they'll have an option to enter the information about that individual. And this will prompt the agency to get verification of this and verify this information before we actually begin communicating with this individual, with this authorized representative, the individual's identified. But this is the first part of the process if they haven't already had an authorized rep connected to their case. So again, for the purpose of this application, we're going to say no. This first question, colloquially known as the ERDC question, is asking if there's any assets that are more than $1 million in the household. We're going to say no. And then this first household information page here is going to pre-populate the information we've already entered about the first household member and give us an opportunity to add additional household members. So we can see that the given names have been carried over from the RIDP and user verification screens, as well as the date of birth and the gender identity. But what we can change is names the individual would like us to use. So let's say that Bob prefers to go by Bobby. And then when that is changed to a different name than what is entered as the given names, it gives us an option of what names we'd like to use on notices. So we'll say he likes to go by Bobby, both personally and professionally. So we'll go Bobby. Asks gender questions here. It asks about gender modality here. It asks if Bobby is a migrant or seasonal farm worker. We're going to say no. That question pertains to expedited SNAP. We'll talk a little bit more about expedited SNAP once we get to that screen. Ethnicity, race, and then we have an option to add a member here. And these questions, the ethnicity, race questions are part of our real D questions. So race, ethnic identity, language, and disability questions that are used for demographic purposes. None of these are used in determining benefits for folks, but it helps us determine, information about the populations we're serving. And so that's why we're collecting this information. So I clicked add household member. We're going to add an additional household member here. We'll say Louise Belcher, whose date of birth will be 9/19/2019. So Bobby's got a kid that he's applying for. It'll ask all the same gender, identity, and modality questions, as well as the race and ethnic identity question. And then when we've added an additional household member, it'll ask if that person is living with the first household member. So you can say yes, yes part-time, no temporarily away, or just no. So we're going to say yes for the purpose of this application. And we're just going to say this is a 2-person application. So we'll be done adding new household members and we'll click next. So this is asking about potentially deceased household members. And if we're intending to apply for medical for any of those deceased household members for up to the 3 months prior to the date of death, there's a potential to cover some medical bills. So we'll say no for the purpose of this application, but if we were to click yes, it would open additional household member information. Oh no, bear with me. So very similar to the previous screen we were on, but it would be specific to the deceased household member.
Uh-oh.
Yeah, that shouldn't be happening. I'm going to go back and see if it lets me proceed, but we'll have to look into that. Yep, I broke it. Okay, we're able to proceed. So this is confirming what benefits we want to apply for each household member. So before we listed all of the benefits that we're applying for, but we'll say, Bobby is applying for cash, medical, and SNAP assistance, and he's applying for ERDC for Luis, as well as the rest of the benefits. So this is asking about retroactive medical benefits or medical benefits that will cover up to the 3 months prior to the date of request. We're going to say no, but this would be the potential for this household to receive some backdated medical benefits. Personal information. So is Bobby providing an SSN? We already provided a social security number, so that's been carried over from that user verification process. Is Bobby a US citizen? We're going to say yes. If we chose no, it'll give us an option to answer a few brief questions about any potential immigration statuses that this individual might have. And this will help in determining eligibility for the different programs. Different programs we offer have different requirements for immigration statuses. That's a whole other conversation to get into, but this is what it would look like if someone was not a citizen and requesting benefits from us. So we'll say that Bobby is a US citizen. And then this is a good opportunity to show the layout of some of our screens as well. So you can see that there's a tab here on the screen for each individual that we've identified as being in this household. So we're on Bobby's right now. This tells me we have some information to enter for Luis as well. If we were to click next, it's going to throw one of those red errors saying like, hey, you didn't enter anything for Luis. So is Luis providing SSN? Yes, they are. And Luis is a US citizen as well. So now when we click next, it should clear those errors and move us on to the next screen. So the first question here on this getting in touch with you contact information screen is asking if everyone in the household has the same contact information. If people have different contact information, we can click no, but we'll click yes for the purpose of this application. We can see when we put in the zip code, it automatically populated the county here. That'll happen almost always. There's some instances in Oregon where a zip code will exist between counties. And what should happen in that case is it should leave this blank and provide an option to select between what county that zip code applies to. Do you live in Oregon? Yes. Do you plan to stay in Oregon? Yes. Those questions are, about residency, which is required for eligibility. How would you like us to reach you? We can ask to not send any paper copies in the mail. We can say paper only, paper and email and text. We'll say paper, email, and text. And then we have the opt-in question for text messages. So you want to receive text alerts from us, click this box to agree to receive text message alerts. We'll click that, it'll have the user verify that phone number once more. You can also authorize voicemails and to contact via email. What language or languages does Bobby use at home? We can enter up to 5 different languages that an individual uses in their household. Say English. And what language does Bobby want us to communicate in person, on the phone, or virtually? This is a good indicator if someone might need an interpreter. We'll say English for Bobby. And what language does Bobby want us to write to them? So the function of this is we have currently handful of different languages, eventually many more different languages available for written communication and correspondence with Oregonians. If right now it's Spanish, English, traditional, and simplified Chinese, Vietnamese, Somali. I feel like I'm forgetting one. Spanish. That would indicate that we're going to send that written communication in that language of choice out to the individual.
Andrew, I swear I'm not going to speak up again after this, but can you click on those so you can show people how they function?
Yes. Yeah. And feel free to interrupt, please. So yeah, English, if I click Spanish here, Russian, if I knew that I spoke like Tagalog, Click that. So it's searchable, and you can scroll through this very large drop down of different languages. And even if it's a language that we may not have any staff that speak that language, or that we can't provide written instruction in that specific language directly from our system, we have access to different communication and translation services. So it's good, a worker would recognize, like, I need to get translation services on the phone before I speak with this person. And then does Bobby need written materials in an alternate format? If we click yes, it'll provide different alternate formats that we have for those written materials. And then does Bobby need or want an interpreter, caption, or other accommodation for communication with them? So if we click yes here, it'll open a number of different options like sign language, assistive listening device, captioning, other things like that. And then also with that option selected, Bobby can indicate that they prefer a bilingual ODHS or OHA employee. And if that's indicated, we'll do our best to accommodate that. Oops. Say no. Nope, and it's going to shoot me an error because I need to enter this for Luis as well. That's actually a different page, excuse me. So this first question on the additional household members, contact information, getting in touch with you page has a checkbox for I have the same address as the case address. If we uncheck that, we'll be able to edit and enter a different address. If we leave that checked, it's just going to carry over that same case level contact information that we have. And then similarly, once we get through the phone and email contact information, we'll have an option to select. What was that? Sorry, I thought I heard someone. So yeah, additionally, they can select that they have the same communication needs as the first household member. So if they select that, it'll populate all of that same information. Otherwise, they can enter their own additional things. So let's say that Luis needs an assistive listening device. So other individual questions, this is the D part of Real D, the disability demographic questions. So if an individual answers yes to one of these questions, it's going to pop an additional drop down in here. It'll ask what age did that condition begin for the individual. If they're deaf or have serious difficulty hearing, they can enter what age it occurred, and it's dynamic to know that Bobby's 31, so it's only going to display 0 or less than 1 through 31. And again, these are part of the Real D questions that aren't used for eligibility purposes. This is for demographic purposes only. And we'll need to enter questions as well for the second household member. No worries. I was just confused for a second. Safety questions. Okay, so these questions will populate. This first one specific to cash benefits. Would you like to talk with someone about concerns you have with your children? That's an indicator for the family coach to help with referrals and talk about that during the family assessment and goals building part of that interaction. These second two questions, the safety questions, do you need to get away from an unsafe, abusive or unsafe situation, or does your partner make you afraid? Those two questions apply to domestic violence, although you cannot apply for domestic violence through this application. What this does is kind of triggers a process for the worker who's reviewing this application to say, looks like someone is expressing that they might have a safety concern, we can offer them to apply for domestic violence assistance, which would be done not through this application, but by connecting them to a worker, whether that's in person in the office, over the phone, or even if they don't want to apply for domestic violence assistance through ODHS, it may be an indicator that we can offer them some referrals to an advocate or to other resources like that. Expedited SNAP. So we did see one expedited SNAP question before asking about being a migrant or seasonal farm worker. So it's been a number of years since I've worked directly with policy, but essentially, high-level overview, expedited SNAP is a requirement for us to process the SNAP benefit application within a 7-day period. And depending on how they answer these questions, it will determine whether this application falls within that expedited criteria. So if the total income is less than $150 a month and have no more than $100 in cash and bank accounts, if the total of the month's income, cash and money in the bank is less than the total housing and utility costs, or if someone meets that migrant and seasonal farm worker, answers yes to that migrant seasonal farm worker question. So I'll say no for the purpose of this application, but these questions are kind of dynamic based on what they're answering. So if they answer yes to this, there's an additional question there. If they answer no, there's this addition asking about the total monthly income compared with the total monthly costs. Other details. So this is asking about for ERDC if Luis has a higher need for a higher level of care. There's different rates that child care providers can provide based on that. So we'll say no.
Okay, I lied. Andrew, click the help text.
Okay, thank you. Help text. So yeah, when these blue question marks appear throughout the application, it'll pop up help text. So this explains a child that requires higher than normal level of care for their age due to a physical, behavioral, or mental disability. Is there shared custody? And are the immunization and shot records up to date? We'll say yes. So a client statement answer to that question is required for the eligibility process.
Question, if they say no, and it's just due to choice that they're not going to use immunizations and they're exempt, does that stop the application, or will the application still continue to process?
So just another disclaimer, that's been a couple years since I've worked with eligibility, but my overall understanding is it doesn't stop. They don't need to be immunized if they are exempt from it and have documentation of that for any number of potential reasons. What I meant was that the question needs to be answered one way or the other, and that a client statement for being immunized, at least when I was doing eligibility, saying that you're immunized without having proof of that is enough to proceed and approve benefits. So you don't need verification of that. You would need verification if you were claiming an exemption. Disability information. Is any member of your household blind or permanently disabled? So if we say yes, we can indicate who is blind or permanently disabled. And if we click that they are blind or permanently disabled, it'll open an additional question that's asking if they're blind, or if we click no one, that's an indicator that they're just disabled. So I'm
Can I
going.
see more detail right next to disability information, please?
Yep. Select yes if any of the following are true for the member of the household. Someone's been determined blind or disabled by SSA, or if they're receiving income from SSA based on blindness or disability. ODHS has determined someone is blind or disabled using SSA criteria, or someone that's experiencing a disabling condition that's expected to last 12 months or more that could result in death or prevents them from being employed. And the final statement here is if you believe you may be blind or have a disability, choose yes. Okay. This question here is asking again for medical, asking about if someone needs assistance with activities of daily living. So this is getting at is if someone needs to request long-term care services for medical. So if we were to answer yes, it would give us an option to apply for assistance with these support services. Ask a couple additional questions about marriage status, total monthly income, any potential assets, trusts or annuities, and then acknowledging if that's accurate. Care services means assistance with everyday activities like bathing, getting dressed, standing and walking. If you want to talk to a caseworker about your needs, answer yes to this question. Household relationships. And this is a cool one to look at because this is actually something for the OOIC folks in the meeting here that we all worked on together to determine what the layout of this screen would look like. So anyone from ECIC on the worker side may have noticed this looks slightly different to how it's laid out in worker portal, though it's asking essentially the same question. It used to be almost exactly as it's worded in the worker portal, but here in the online portal, we wanted to make it a little bit more clear. So it's very specific. Bobby Belcher is Louise Belcher's parent. And then some questions in the application, this being one of them, will dynamically populate for the second household member based on what's entered for the first household member. So when we click over to Louise to enter an answer for them, we'll see it's already stated that Louise Belcher is Bobby Belcher's child.
Andrew, what if they have more than one child? Then what?
We would have entered that back on the individual or the household information screen. We would have added additional children, and it would list all of those household members on that screen. So anyone who's in the household will be listed on that screen, and they will all have to answer how they're related to each other. So unable to work. Are you or anyone in your household unable to work due to a physical, mental, or behavioral health reason? So if we say yes, we can indicate who is unable to work, and this will go towards requirements to participate in things like the ABOD program for SNAP or the JOBS program for TANF. Tax filing information for certain medical programs. We need to know the tax filing status of individuals. So we'll say it's filing as head of household with a dependent. So it's asking to click if select who's a dependent and if they'll have the same tax status in the next year as in the current year. So these questions will help decide whose information, including income, may be used to determine what medical assistance programs you qualify for. Can't answer specific questions about how you should fill out your tax forms. Recommends irs.gov or a tax. This one, since we clicked that Louise is a dependent of Bobby, should dynamically populate on their tab, dependent of individual in the household. So the AIAN, American Indian, Alaskan Native, and tribal land residency information, these apply to TANF and SNAP and certain medical, asking if, everything from if they live in a tribal area that would exempt them from certain work requirements in the SNAP program to if they're receiving tribal benefits from any tribe they may be associated to. If your members of your family are members of federally recognized tribes, you might qualify for certain enrollment rights, and by providing your AIAN information, we'll be able to better determine if you qualify. Living arrangement. Where does Bobby currently live? He lives in home. And Luis also lives in home, but you can see there's a number of different living arrangement options. And particularly for medical, these can apply to living facilities, foster care facilities, things like that. Prison jail status. Has anyone in the household been released from prison or jail? Some can affect medical eligibility, depending, what time period folks are eligible for benefits. Education and school attendance. So this has impact on everything from SNAP to ERDC, and if someone, for SNAP, if someone is indicating they're a student of higher education, we have to go through some additional eligibility to determine if they're eligible for the SNAP program. And for ERDC, they can qualify for student hours for childcare based on how many hours they're working and how many hours of study time they're eligible for, and things like that. So we're going to say not currently enrolled in school and not attending school in the last 12 months. And Luis, say kindergarten. Let's see, they're currently enrolled in school in an elementary school. Courses are not being taken online. I don't know, let's see. Just guessing there. I don't. My brain's not going to do the math on when they would be a senior in high school. And then this isn't a required field, but I could enter the name of a school and the enrollment type: full-time, half-time, less than half-time, or more than half-time. Household questions. So is anyone in our house pregnant or has been pregnant in the last 3 months? If someone was pregnant, they could enter that here, and that will qualify them for certain medical benefits. It will, depending on the due date, qualify them for TANF benefits. Out-of-state benefits, we need to verify if anyone's had benefits in another state within the past 3 months. We need to verify that those benefits have closed. Tribal benefits, if anyone's currently receiving various tribal benefits, anyone's receiving or applied for SSI and has been denied or is waiting for an appeal. This explains what SSI is. Other benefits, does anyone have potentially able to have money or health insurance because they're out of work, retired, or permanently disabled? So this could be Social Security, veterans benefits, unemployment, workers' comp, Medicare. Accident or injury settlement, Medicare details. So if we answered yes to this, it would prompt a Medicare details screen, which would qualify, someone who's receiving Medicare would qualify them for specific medical benefits. And felony details for food and cash benefits. So if someone self-attests to being a felon with an active arrest warrant, could potentially affect their eligibility. Resource questions. So we'll say they have liquid resources. Bobby has some liquid resources. And these are just gate post screens that we're going through. So it's just asking a very overarching question here. Does Bobby have any of these different kind of resources? Then once we move on past this gate post screen, we'll see specific screens to enter more details about what we've put in here. So does he have a vehicle, any life or burial insurance, prepaid burial agreement, burial space, real property, life estate, annuity, trust, loans, QPP, or other resources. When we click next, it should bring us to any of the screens we clicked yes for. So we said Bobby's got some liquid resources. He's got a checking account with $500 in there. Any additional names? We'll say no. No one from outside of the household is named on this checking account. We could add additional resources by clicking add resource here, or when we click next, we'll be brought to a summary page to look and overview what we've added here. So we can see $500 liquid resource checking account is what we've added to the case. We could add more resources from here again, or we can just proceed on through the application. Income information. Again, this is a gatepost screen where we can answer one of 4 types of income. Earned income, we'll say Bobby has earned income. He could also identify self-employment income, unearned income, unpaid work activity, or specific income. So we'll say he just got earned income for the purpose of this application. So now we're on the earned income screen. We'll say the category is wages. The income type is also wages. You can enter tips, different sources of bonuses or additional types of wage payments. Bobby works at Bob's Burgers. And he works 75 hours a pay period. He's paid monthly. And he makes $1,500 a month. Did his employment start prior to the 1st of July? So if we say yes, we'll just move on through the application. If we say no, it's going to ask about specific income start dates and when that first pay would be received. So that will help with if we need to prorate any of this income or if we can count that whole $1,500 per month. If Bobby's temporarily away for employment or on work without pay, and we answer that, we can say what the reason is, when that temporary leave started, when they expect to return to work, and if this employment's ended, and what a reason for the employment end date is. And all those go into both prorating income, whether or not we need to count income as ongoing if someone is temporarily away from work, or if there was good cause for leaving a previously active employment, which good cause comes into play for eligibility for a number of different programs that we offer. And so then again, we're on the income summary screen here, and we can see we've added that $1,500 monthly. So now we're on the expense gatepost screen. We'll say that Bobby and Louise have shelter expenses, utility expenses. And in this example, we have one adult and one child in the household. So I'm just selecting that Bobby is the one who's paying for housing. If we had multiple adults in this household who split income or split, expenses, we could indicate that multiple people share that cost, and the system will do the math to count what each individual pays. We also have medical expenses, child support expenses, dependent care, alimony, spousal expenses, education, and deductions. Excuse me. So here we can enter a number of different types of shelter expense. We'll say that they are paying rent monthly, and their full monthly amount for rent is, say, $2,500. Are utilities included? We'll say yes, utilities are included. And that goes to determining what type of discount they're getting for the utility discount for SNAP. And since we on this screen clicked, or on the previous screen, the gatepost screen, clicked multiple different sources for the expenses, we should go to the next screen once this screen processes, which should be the utility expenses before we get to that summary page. Has anyone received a low income home energy assistance program or LIHEAP in the past 12 months where they live now? It's the Heat and Eat program. I think I want to say it's like an additional one-time payment for SNAP benefits if they've received that. We'll say that Bobby pays water and garbage in addition to the utilities that are included in the rent that they pay. And then on the summary screen, we can see both the shelter expense that we entered, as well as the water and garbage. This here, if I would have selected gas, wood, or electric, or anything that would be a source of heating or cooling, we also would have been prompted with a question to answer if that was the primary source of heating or cooling for the household. So the annual income summary. So for medical, the annual income is used to determine eligibility for some medical programs rather than looking at the month-by-month income. So the current functionality of the screen is it'll show a projected amount based off of what we entered on those income screens. And what we have an option to do here is say, yeah, it's going to be different from what that projected amount is, or no, that projected amount is correct. So let's say he only expected to receive $7,000 in 2024. So we can enter that there. Once we selected yes, that field was activated. If we click no, we'll see that 0 populates, or whatever was over here in the projected amount populates in that field. Same for expenses and deductions. And then it also will ask about the next year. So the projected income amount for next year, $18. And we'll say, no, it's not expected to be different than that. So we'll see that number carried over into the expected amount. Same for these Social Security and unearned incomes. And same for these expenses and deductions. Oops. We can see we got a red banner because I didn't enter anything for Luis. So since Luis is only 5, we don't expect any income or expenses for them. School and work schedule. So since we applied for ERDC, we need to provide either the school or the work schedule. Since we said that Bobby's not currently enrolled in school, it's going to be a work schedule. So we'll say that Bobby works Monday, Tuesday, and Wednesday. Work schedule starts at 8 and works till 3. And as you can see, each day that we indicated, each day that we indicated up here in this top selection of what days the individual works or goes to school are all populated down here where we need to enter specific details about those. The employability screening applies to the TANF program. It's an eligibility requirement to complete this with the eligibility worker. And we've recently added this screen through one of our recent changes to applicant portal. It used to only exist really in a paper form that would be gone over with the worker. Now these questions have been added here as well as in the worker portal. The only required question from the applicant portal side is verifying that they've reviewed and completed the fields. Though hopefully with having all of these questions completed, that will be a good starting point for the TANF engagement process and for getting that eligibility part cleared so that they can get TANF benefits started. So we'll say, yeah, Bobby's looking for some more work. kitchen work. Bobby needs some gas. Bobby has worked in the last 4 months. Does Bobby have any health issues that may impact their ability to work? We'll say no. Do they have to care for somebody with a developmental, physical, or mental health condition? This explains what developmental conditions could be. And ODHS is required to provide any reasonable accommodation you may need. Accommodation is connected to a disability. Does Bobby need ODHS to provide accommodation? And so again, these questions go towards starting that engagement process with a family coach for TANF for the jobs program. Child support cooperation required for both medical and for TANF benefits. So this question here is asking if any of these are true. If we believe that that the absent parent may cause harm to the applicant or the dependent, if the dependent was legally adopted, or if they're in the process of being adopted. If any of these are true, we answer yes. We're going to say no. I don't think, yeah, there's no additional questions here, but if we say no, that indicates they don't really have any, at least that they're identifying here, safety or other concerns about pursuing child support from the absent parent. If they answer yes, that's a good indicator that maybe there's a reason they don't want to, or it would be unsafe for them to pursue child support. And that should always be a conversation they're having with the family coach about what is safe for them and about their requirement to cooperate with DCS. And that process is handled through DCS. We should just be helping to facilitate that process if the applicant wants to volunteer any information and it's safe for them to do so. Health coverage and benefits information. So this is asking again for medical, if there's any adult or children who have insurance coverage and offer for it or eligible for it. It could be dental coverage or any part of Medicare. Or wait, mark no if they only have OHP or Medicare, excuse me. So if we enter yes, it'll open a bunch of different questions here. And I'm going to say no because, to be honest, I'm not sure exactly. I don't know medical policy very well, so I'm not confident in walking through this part of the application. So we'll say no, but it does affect medical and the potential eligibility for certain medical benefits. Can anyone be covered through an employer-sponsored health plan who is not yet enrolled? Again, we're going to say no for the purpose of this application. And then CCO choice. So depending on the county that the person resides in, they have different options for CCOs, a coordinated care organization. Some counties only have one, some counties have multiple. Looks like Marion County just has Pacific Source Community Solutions. So we'll choose that for these individuals. And so now we're at the review part of the application. So we can review everything that we've entered on this application before submitting it. So we can see who we've put in the household here. If we want to, review the relationships for the household, we can open that drop down, see what programs we requested. Take a look at the income, resources, and all of these have an option to edit and go back to those screens and change what we've entered or add new information there before we proceed to submitting this application. So additional resources that we're offering here for domestic violence, child support, child care, seniors and disabilities. Rights and responsibilities. So this page will go over all of the different rights and responsibilities that apply to each different program. Program acknowledgements, additional information about the programs that the individual or family has applied for. Estate recovery. Received help for paying for certain long-term care costs and other benefits, gives information about how to find out more about that. And then details on reporting changes and explaining when we report a change, the worker will let us know if we need to give proof. If the change affects other benefits they receive, the department will let us know. Penalties. It's about giving false information or committing fraud. Information for all programs about non-discrimination policy, information for the governor's advocacy office, why we need and ask for the social security number and how we use it, and our information sharing policies. Veteran information, someone can indicate yes, they are a veteran. Ask different questions about full-time active duty, National Guard, if they would like to be contacted, or by the Veterans Affairs Department regarding other resources. So it's an opportunity for us to provide additional resources, but also may qualify somebody for veteran dental benefits if they don't qualify for regular medical benefits and they are a veteran, they could still qualify for veteran dental. For registration, we're required to ask this, and if we click yes, we'll send information on how to register to vote. It should be coming up on the sign and submit page. So by my signature, I agree with it below. So this is again just an overview of what we're agreeing to by signing and submitting this application. And then we get to the e-signature down here. So by entering my name below, I'm electronically signing my application. And as we indicated that Bobby likes to use Bobby Belcher for written materials as well, we'll sign as Bobby Belcher. And so now we're going to go through the submission process. This could take a couple minutes at the most, hopefully. So I think now if anybody has questions or input, this may be a brief few minutes where we can revisit something from the chat, or if Sam, you have something you want to add.
Yeah, Andrew. This is George.
Hey, George.
The question I want to ask you is, when it came to Social Security and with the question mark, did you and James and Samantha put in the types of Social Security? Like there's more than one type of Social Security. There's SSI, SSDI, SSDAI.
Yeah, so when reporting income, we have the option to report all of those different sources of income for SSI. Some of the questions on the application are asking specifically just about SSI. So I don't know, it's hard to totally answer that question because I think there are parts of the application that do include all of that information and other parts that are specific to just one type of Social Security.
Yeah, there's a couple of different screens, George, and we can dig into them a little bit more if you'd like to. Maybe during a OOIC meeting or offline, we can do another chat. So we do try to spell out when we say like blanket terms like social security income, or income through the SSA, we do try to cover what types of social security, but there are times, as Andrew said, screens where we're just collecting information about SSI or SSDI, SSB, etc. So we can deep dive on those at another time if you'd like to.
Yeah, I just had a question where that question mark was. That was because it was going by too fast on that one question mark on Social Security. I didn't catch too quick.
Yeah, we'll go back and look at it.
Yeah, sorry if I was moving fast because I want to make sure we got through the whole application and, covered most of what I could without going too much into eligibility as eligibility is not my current focus, or now it's more of the system flow. But good question, George. We'll take a look. So this first screen we come to after signing and submitting the application is the miscellaneous document uploads. This gives an opportunity before we've even asked for any additional information through RFIs or PENs for someone to upload proof of income, citizen or ID documents, proof that benefits have ended in another state, or the most recent thing we've added here is if you're a student of higher education, to submit any financial aid award letters or financial aid documents you might have. So just kind of preemptively, a lot of folks will know that they need to submit some verification or proof of the income that they have or the other documents that they have, and this gives them an opportunity to do that. So if we have files in any of these types here and no larger than 6 megabytes, we can browse our computer. Should pop up a browser window, a file browser window, and we can select any files that we might want to upload there. And then let's say like tax returns. And I chose an invalid file type. Let me see if I have something else that will work. It was probably too large. Excuse me. Just waiting. Peter's thinking.
While it's thinking, I do see that Delaney has their hand up. Delaney, did you have a question?
I did, yeah. Can you guys hear me okay?
Mhm.
Yes, okay, cool. Sounds good. My headset's been acting up, so I want to make sure. So I just had a question, and this may be a little bit deeper of a conversation for what we are doing today, but what is the probability of adding program requirements to some of these screens when they're selecting which programs they would like to apply for? Like the one that sticks out in my mind the most is the TANF cash program. There's a lot of people who apply for that, not realizing what those program requirements are. And then it wastes an hour and a half of their time just doing the interview process, plus however long it takes them to get through the application. So what is that an option down the line at some point of adding like a little screen that pops up with program requirements on there, what programs they are applying for?
So are you talking more about like eligibility requirements or like things they'd be asked to do, like the jobs program? I guess that
Like
is
eligibility requirements and also like other requirements if they are approved for it, like you said, like the Jobs Plus program and stuff like that, because sometimes that is a deal breaker for people as well. So I'm gonna say yes to that. Like anything.
So I think in general we want to avoid encouraging people to make their own eligibility decisions. Well, I think your concern is valid. There probably is a population of people out there who will just apply for whatever they can apply for, and whether or not they qualify or not, and then they may get frustrated that like, oh, why did I go through this whole process when I could have known that I didn't qualify in the first place? I think in general we don't want to put anything there that would discourage somebody who may qualify, because I think while there are some pretty black and white eligibility requirements for our programs, I think sometimes it's best for the eligibility worker to decide that for them. So that would be my answer.
Okay, yeah, and I get that there is definitely a line that we need to ride, but I mean, we're also about transparency, right? So program requirements is something that we should be transparent about. It's not something that people should have to dig for, in my opinion. So, okay, I was just curious if what that looked like at some point. So thank you.
Yeah, and don't want to shut the conversation down entirely. If we decide there is part of that that would benefit people and wouldn't discourage people from applying, I guess that's my main concern, is discouraging anyone from applying and without actually going through a legitimate eligibility process. But yeah, good question. So the document is uploaded. We can see the document I uploaded here has been attached. We can delete it, we can view it, or we can attach another document. We'll go ahead and click next. So we can see a summary here of what we uploaded. Document upload is complete. And then we get to the programs you qualify for, eligibility results page. So we can see cash assistance, we're pending for completion of the application process. It's kind of cut off here, but it's basically saying providing information. Actually, I know what I can do. I can zoom out. Application process may include providing required information, department review, or interview with a worker, and a worker must review this application before a decision can be made. Pending for cash, SNAP, and ERDC, and that's because our online portal here only runs eligibility for Magi Medical. So since both of these individuals were eligible for Magi Medical, we can see that they were approved. But there will be various RFIs that have been generated for these other programs. Next steps, kind of explains some of the proof that we need and examples of what that proof might be. And this isn't specific to the case, this is very general. The case will be sent specific requests for information for the pending information that we need to determine eligibility for this case. And we're going to say no thanks to the paperless question currently. And so then we can see after getting through that whole application process, we're navigated to the dashboard. So we can see what programs here are pending. As mentioned, that's ERDC, cash, and SNAP. And we can see below the current benefits that we're approved for. It shows us the eligibility effective date, the next renewal date, and the coverage type. And we can click view my verification of current medical benefits here. If we click that, it'll pop up a option to download or print that medical benefit. Should. Computer's not responding, so there we go. So should display it here like this, as well as options to save, print. We'll get more into the mobile app next presentation, but this is also available on the mobile apps. So an individual could just pull this up on their mobile app and show it to, for example, an organization that needs verification they receive public benefits. One additional section that will appear up at the top here, it requires some batches in this test environment, so it's not showing up currently, but it will display the RFIs that are needed for the various programs to submit for determining the rest of the eligibility. So that is all we planned to cover for this presentation. We've got about 8 minutes left. If anybody has any pressing questions or comments, or if Sam or James, you'd like to add anything.
I would just say if there's any other questions. While you're thinking of them, I'll just remind you that we will have part 2 of this. We're talking about notices, the mobile app, periodic reports, all sorts of fun stuff in our second installment.
Yeah, so my plan for the next presentation, and it's 2 weeks from today on the 29th, right? 29th. Is kind of to pick up where we're at here, and we'll get the RFIs generated on the case so that we can look at what it's like following up on those from the online portal side. We'll look at the messages that we can receive in the message center, how correspondence and notices are viewed here. We'll look at some of these different options of navigating through the online portal, and then look also at the Oregon One mobile app and what we can do with that to manage benefits. So focused more on now we've got benefits applied for, and what can we use this to do to manage those benefits, both this and the mobile app.
And Drew,
Yes, it looks like Susan has her hand up.
So there used to be a place where we, even though they weren't pending for the documents on the dashboard, now you have to submit a change in order to upload documents like our authorization for community partner help. I try to just report a change and to upload my authorization form, but I didn't make a change, and it said you didn't make any changes, and it wouldn't let me do anything. So I had to go back and like change something in the application just to be able to upload something into the case so the worker could see it.
So we have not allowed upload outside of the context of a change in like 4 years. But I will tell you, Susan, that for the purpose of the community partner authorizations, we are looking at an opportunity to add that during association back on the CP dashboard, because we do know that as we continue to expand the CPOP program, we'll be wanting to accept those. So trust me, working with Christy Taylor on that one, we keep trying to get it prioritized. We're hearing you and definitely understand that you guys need that taken care of. The change, so there was a request that came from SED, which is our service, nope.
It's statewide eligibility, design, and delivery.
Thank you, Katie, for saving me. Our operations to stop allowing reported changes where nothing has changed, because workers were getting completely confused. They're like, what's the change? I don't understand. So I do know that's hamstrung the community partner CPOP group a little bit until we can get the change in to allow you guys to upload the authorization form, the consent form, sorry, from your dashboard. What I would recommend is if you have nothing else to report, you are just associating, I would just email in the consent form and let them know that you're already associated. You just want the consent form on file.
Andrew, this is George.
Hey, George.
All those programs that we were working on this committee months ago and stuff, does that combine medical, food stamps, and state services all in this one application here?
Yeah, so when we work together in the OIC group and we're proposing changes here, generally changes we're making to this application apply to the portal here, apply to all benefits. Now, that being said, certain questions and certain parts of that'll be presented through the application process do apply to specific benefits, but generally I would say, at least in the time that I've worked on the committee, what we're working on is usually larger scope, covering everything. Although I know we're talking recently about displaying specific things for like ERDC, for example. So usually it's an overarching change that will affect all programs, but sometimes it can be a little bit more specific.
Okay.
Yeah. Mercedes?
Hi, I guess I wanted to follow up with the previous person that had communicated having issues with community partner consent. What I have heard from Oregonians is that they have a hard time uploading anything through the applicant portal. And I've heard that they say if there isn't something pending, they're not allowed to upload. What I just heard is that they have to select reported change in order to upload, or can there just be a button that says upload? I mean, I don't know what the issue is because obviously I'm not in here, but it isn't very simple to look at this page right now and see where do I upload the information this worker wants when I have them on the phone.
Yeah, so go ahead, Sam.
Are you letting me go?
Yes, please.
Okay. So that's a great point, Mercedes. The worker should be running eligibility to let them to basically create the request for information. And once that eligibility has been run, it will be available for the customer to upload from their portal. The reason we don't just allow upload, right, is because people could upload something when they're not on the phone with the worker. Just come in and upload one paycheck stub that we have no context for. We don't know if that's a new paycheck stub. We don't know if that's a change that they're saying is going to go on forever. We can get things completely out of context, and that generates a lot of work for workers to have to figure out, why did I just get this, and what does this person need me to do with it? So if there's a couple of ways they can upload. When they're going through their application, as Andrew just demonstrated for us, there's an opportunity to upload and it will attach to the application. Another way is to wait for the worker to run eligibility and to see if anything is pending, because then that pen will be available on their dashboard for them to respond to, and we'll be able to allow them to upload those items to resolve that pen. And the final way, of course, is, as Susan suggested, reporting a change. And really, we do it that way, like I said, just to confirm that there's context around the items they're uploading, so that we don't have all that work around trying to figure out, well, they're at month 3 and I don't know why they just uploaded a picture of their cat.
Okay, well, like a dash next to reported change, and then something that says if you're reporting, if they're going to submit a pay stub, because when I do my reviews with Oregonians, I'll say, since I know that your employment might end here in 2 more months because it's seasonal, go ahead and you can go on your applicant, your portal and upload things. But if there's nothing pending, then I could instruct them do a report change in order to upload whatever you want to send us, or like receipts for people for LTC, right? But
yeah,
can there the reported change have a little dash and have some sort of hint if you're wanting to report that I don't know, just something, because I don't know if it's obvious to them, but I hear that a lot. They always call and say, I cannot upload. I try to upload my ID. It just would not. So.
Yeah,
well,
it's a good. Sorry, Sam, go for it.
Let's wait and see after the end of the next session to see if we've resolved it and gotten somewhere where you're feeling more with this and you're liking the functionality. But I don't want to lose that you're having people who are confused about how to upload and respond to things. So are you coming to the next session? And if so, can we bring this back around at the end of the next session?
Yeah, no, yeah, absolutely. I mean, I don't expect any of my opinions to be immediately changed, if at all. It was more that's kind of the feedback I get from folks, and I just don't know. because we do tell them you can go anytime through the applicant portal and upload the document that you will get later, but that's not true. I
Right.
mean, and if I can't, like you say, well, why don't you pen for something? But sometimes it's not something that is pendable for them to upload. So
Right.
just any like a little question mark that they hover over, and then it'll say this report change includes X, Y, and Z. I don't know, something.
Yeah, no, absolutely. I think that you're exposing like a big issue we're having, and I really do want to honor that. That's really great feedback. And I think at the end of the next session, we might be able to hone in a little bit closer on how exactly we can address the gap that you're exposing for us right now. So thank you, Mercedes. I appreciate it.
Thank you. Yeah, thanks very much. Just one thing I wanted to add to that is I think partially we also don't, the reporting requirements that we talk about in the application process, only certain things for certain benefits are required to be reported. So I think in a way, we want to avoid allowing somebody to report a change they may not have to, that could have a negative impact on their benefits. And so I think it's about finding the balance of that, but also, the highest level of usability and ease of use that we can for the portal. But great feedback. We're over time just for anybody who needs to leave. I personally have some time and can stick around and help answer the rest of the questions. So just wanted to let anyone know who needs to go that thanks for being here. But then let's move on. I think Trisha had their hand up. Trisha?
Just still on mute, Trisha.
Okay, can you hear me now? Sorry, I got a new headset.
Yep.
I had to pull a little arm down to let me talk on it. So in regards to Mercedes' comment, I would think listening to you guys talk about things that we're working on to get the Oregonians to be able to do things. It sort of sounds like, going off of what I've heard, is really, if they want to upload something, we can always give them the Oregon one. We could always give, like, some offices have local. I mean, you can get fax or mail. I mean, if it's not just that we're going to upload into the one system under the ONE online portal, right? So I just think that I kind of agree with what Andrew was saying. Like, there are some things that we don't have to, they don't have to report, that if we give them the ability to upload sometimes, that might be a negative for them, versus if they talk to a worker and then the worker said, okay, yeah, you might want to do this or that, potentially is what I'm thinking. So I'm not sure if we just want people being able to upload just anything and everything. And I mean,
Yeah.
it might make it worse for them, I would think.
Yeah, good point. And I think that's I think, like I said, I feel like finding a balance between, like Mercedes saying, like can we have something that explains how to report or what to report, things like just making it easier to know how the system functions and how we can better message that, so that both for Oregonians and for our partners, we make what functions exist in the system, we make it easier to use those the way that they're meant to be used. But all good feedback from both sides. Susan?
Are we going to be going over reporting a change next meeting? I wasn't sure what we're reviewing next meeting.
Yeah, so my plan was to kind of, like I said, pick up where we left off, look at some of the RFI stuff. But then certainly I think, especially with knowing these questions that have come up over the last 10 or 15 minutes, I think reporting a change is a huge thing that we want to key in on and look at what that looks like and what happens in the system when we do that. And so yeah, I will make a plan to include that as part of it. And we'll have the same amount of time, an hour and a half. So it takes quite a while to get through the application process, but some of those other things don't take quite as long. So we should hopefully be able to have a lot of different things to cover in the next meeting.
Well, Andrew, thank you. Samantha, thank you for staffing the chat. And like Andrew said, we'll be back in 2 weeks, same time. And this recording will be available in just a few days on our OEP listserv on YouTube, but I'll make sure to send the link out when it becomes available.
James, what time was it going to be on the 29th?
Will be the same time as this one, so from 2 to 3:30.
Okay.